July is Sarcoma Awareness Month, an important opportunity to highlight this rare and devastating disease. The importance of seeking sarcoma specialized care and tools like biomarker testing that can help providers better understand each patient's disease and guide them toward the most appropriate treatment approach. Joining us today are Dr. Yoon, a pediatric hematologist-oncologist who will explain the science behind biomarker testing, as well as Lindsiy, who is sharing her story of diagnosis and recovery. Thank you both for joining us today. Let's start by going over what synovial sarcoma is and what are the common symptoms.
Synovial sarcoma is a rare cancer that falls under a larger category called soft tissue sarcomas. It tends to affect patients in the adolescent and young adult age groups, typically ages 15 to 39 years of age. It can present with pain and may be associated with a lump, usually in the arms or legs.
What makes this such a devastating type of cancer?
So the earlier it's diagnosed, the more responsive it tends to be to treatment. Unfortunately, if it has metastasized, and that's usually to the lungs, the 5-year survival rates are only about 20%. And as I said previously, this tumor tends to affect patients who are young and are in the prime of their lives, like Lindsiy, which makes it particularly devastating.
Lindsiy, can you share what led you to seek specialized care?
Of course, what led me to seek specialized care was pain in my inner left thigh. At the time, I was 20 years old serving in the United States military, and there were several occasions where I would experience pain in my inner left thigh during runs. At first, I overlooked that pain and, pushed through. But as time went on, that pain would gradually get worse and would appear more during my daily activities. There were many times where I would squat and I would notice my left leg not go as low as my right leg. And when I would force that movement down, there would be a sharp stinging pain in my inner left thigh. Same with lunges. When I would do lunges, my left leg wouldn't go all the way down and I would experience pain. So that's definitely what, put a red flag and had me seek specialized care.
Dr. Yoon, why is biomarker testing important early in one's diagnosis journey?
As we're learning more about cancers, we're learning more about biomarkers they can express. And tumor types such as synovial sarcoma are associated with biomarkers that can drive treatment options. And our hope is for all patients to have outcomes like Lindsiy. And it's incredibly important to have this biomarker testing done early and to be treated at sarcoma specialty centers such as ours at City of Hope National Medical Center in Duarte, California, given the rarity of this tumor type.
Where can our viewers go for more information?
You can go to sarcomabiomarkertesting.com to learn more. I can't urge enough the importance of getting biomarker testing done early to discuss treatment options with your care team.
Thank you both for joining us today. And to our viewers, we have more Studio 4 coming up. Keep it here.